One question which is there in the minds of countless people across the country is this: is India headed for a third wave of COVID? And if so, when exactly will it take place? What are the chances that it will not happen? And where exactly has the Delta variant and the Delta plus variant spread in different parts of our country? What about the R number for COVID, the rate at which you can gauge the relative infectiousness of the virus as it infects more than one person? It goes from one person to possibly even more than one person. Well, joining us now, Dr. Samiran Panda, the head of Epidemiology and Communicable Diseases at the Indian Council for Medical Research. Thank you very much for being with us. Now, we've got a lot of questions from our viewers. So let me start up with the first one, and it's the most obvious one. Is India headed for a third wave of COVID?
Well, a third wave is possible, but that does not mean that it would be as severe as the second wave. So yes, given the information that we have in terms of the vulnerability of the Indians, in terms of their past experiences or exposure with the multiple waves of SARS-CoV-2 infection, and then of course the vaccination is also going on, taking all these things together and the existing or the residual vulnerability, it will be prudent to assume that there will be a third wave, but that does not or should not necessarily make us think that it's going to be as severe as the second wave.
So would it be fair to say that there will be a third wave which will not be as severe as the second wave? Is that what you're saying?
Yes, of course. And in fact, if you look into the data that has been generated by a couple of states, who have conducted their own serological surveillance, as we call it, apart from the national serological surveillance, they have the indications that there were small little waves happening even before the so-called big second wave. For them, it was probably the third or the fourth wave that was happening. So yes, it would be fair to say that there would be a nationwide also a third wave, but not as high or as intense as the second wave.
Is it possible to give an idea of how big a third wave would be based on epidemiological trends and tracking the virus?
Yeah, that's, Vishnu, is a question that everybody asks. Actually, three things are asked. When is it going to happen, if it happens at all? And then how intense that would be, and how long would it stay? And the uncertainties around each one of them are so much that answering them with any kind of certitude would be difficult. But I would say, if you allow me to explain
Please
it
go ahead, yes.
Yeah, so there could be four things which could lead to the causation of a third wave. One is the immunity that we have acquired, mostly through the natural infection, due to the first wave and the second wave. If that immunity post natural infection, I'm talking about that, if that wanes, if that comes down, that could give rise to a third wave. And then naturally, the question is how quickly that should come down. Is it 4 months period, 5 months period, and then there is a chance of us becoming again susceptible? So that's one scenario, or it comes down after 12 months. So naturally, it depends on the duration of the protection that we have acquired due to the natural infection.
Yes.
The second situation could be a variant which has emerged that can escape the immunity that has been acquired by us, either due to natural infection or post-vaccination. So then it would give rise to a situation that the new variant is able to escape the immunity, and that's why it is causing a third wave. The third situation which could happen is there is no new variant which is escaping the immunity, but it is so efficient in terms of getting transmitted very quickly. Then also it is possible, although it is still under the immune radar. Let's put it that we have acquired in our system. But due to sheer ability to get transmitted pretty fast or very efficiently, that could give rise to third wave. And the fourth and the last thing that could happen is different state level restrictions that have been imposed or instated. If that is lifted a little prematurely, then the infection could go back up.
Okay.
Now, it is not necessary that each one of them happens, in an isolated fashion.
Right.
So we did a modeling exercise, from Indian Council of Medical Research in collaboration with the Imperial College London. And there we assume that let us think of a variant which is not only able to escape the immunity, but also able to, it is able to spread pretty efficiently, fast spreader. In that situation, even if a third wave happens, our model showed that the height of it is not going to be as high as we witnessed, or the country witnessed during the second wave, number one. And number two, when it could happen is dependent on how quickly this new variant is occurring. But even if it occurs very close to the time that we are passing through, then again, the third wave might start showing its head around August end if both these factors are happening.
And by variant, you mean Delta plus?
Delta plus, actually, India has seen such a spread of it and it is very transmission efficient. So I am not expecting any more havoc, public health, from public health perspective, any more havoc caused by Delta or Delta plus, because Delta plus is one more new mutation happening on the Delta variant. So extensive spread has already happened. So I'm talking about another variant following this that might be able to have the ability of escaping the immunity and the transmission ability.
What variant would that be, sir?
That is anybody's guess.
No, I asked this because is it out there already?
No. So my clear response to that is no. So we need not be panicked at all. But the other situations, Vishnu, we should also discuss. The fourth one, the last one actually. So some of the states which instated their, restrictive measures pretty early, so they did not see what Delhi witnessed or Maharashtra witnessed. Delhi or Maharashtra actually were closer to the peak when they instated, I'm talking about the second wave, when they instated their state level lockdown. So by that time, most of the majority, I should not say most, probably half of or a little more than half of the population, the state population, got infected and acquired a form of immunity. So the remaining vulnerable population was much less. But taking the example from Delhi and Maharashtra, what northeastern states did, they instated their state level restriction early on. So what that did not allow the second wave to take place or reach its peak.
Right.
However, it left quite a large number of people vulnerable. So if that restriction is lifted early on without ramping up the vaccination, then there is a chance.
Okay, so Dr. Panda, I've understood this, and I'm trying to just, by the end of August, is that what you said, we could see the onset of a third wave? And that onset would be essentially Delta, which is what is surging now, unless there is a new variant, which can of course happen at any time. So unless a new variant emerges, it would still be Delta and whatever we are seeing of Delta plus, which would constitute the beginning of a third wave, correct?
Yes.
By the end of August?
By the end of August, the onset of it.
Correct.
But it is,
So what does the rising R number of COVID indicate? Is this indicating where we are headed to by the end of August?
This is a very good question. So R that we saw during the second wave, we did a calculation, it's around 2.5. But now we must all discuss about what R is dependent on. Mm-hmm. Let's assume that in a rural setting or in a state where the population density is not as thick or as dense as we see in Delhi or Calcutta or Mumbai. So in that situation, you do not see a high R. But if tourists or a larger mass of people come from another state and actually change the population density of a state or of an area, which was otherwise having less dense population, then it offers an opportunity for faster transmission. That's why it is so very important for us to consider. Of course, everybody recognizes the fatigue in terms of the prevention, how long can we remain locked up. But responsible traveling is what is required.
So responsible travel, and I'm interrupting you only because I will talk about that at length. But I want to just take this graphic full screen and then get your thoughts on it. Let's have that graphic up full screen for our viewers. What you actually see is the actual number of cases, at the indicator of the spread, and the average vaccinations per day. And I think, one of them is the R factor. That's the blue line that's going up, and the black line that you see going down is the average vaccinations. And therefore, the R factor is an indicator of the spread. And the bottom line over here, Dr. Panda, perhaps you'd agree, is that if we vaccinate less or not at the rate that we want, then that R factor is bound to go up. And the more it goes up, it just basically indicates that each person who contracts COVID is potentially infecting more than one. It could be many. Is that right?
Yes, you explained it very well and very clearly. And it could, one infected person could infect, 2 or 3. Then we are talking about R as 2 or 3.
So that's and therefore that multiplier effect becomes scary if you have a large number of cases. And that's the big worry for India, because we're a large country. So if you have 40,000 new cases a day in India, and if that R is above 1, or say it is at 2, and we never want that situation, then that 40,000 hypothetically infects 80,000 people. Those 80,000 people will therefore infect at a factor of 2, 1.6 lakh people, and then the number changes because some people start getting better, right? That's the recovery rate. But then that multiplier effect is frightening. That's the bottom line.
Yes. You have to take a pause here and discuss two things very clearly. Those who are vaccinated, these vaccines are not infection-preventing vaccines.
Right.
They are disease-modifier vaccines. So even if I'm vaccinated, it does not, protect me from acquiring or acquisition of the infection from others. Once I get the infection, maybe for myself, as I'm vaccinated, I won't get to the severe state of the disease, or I may not require, getting admitted to the hospital or require oxygen.
But you can infect somebody else.
Yes. Now, those who I would be able to infect, amongst them again, not that everybody will be symptomatic, because out of 100 infected people, 80, generally, I'm giving you a ballpark figure, basically here, would remain asymptomatic. So 20 will remain symptomatic, and out of 20, we can say again 20%, which is like 4, they would show up in the hospital. So in order to have your preparedness for the third wave, should there be one, these kind of calculations to help. So what all I'm trying to say here is that what vaccine does is it stops the link between the infection and the severity or symptomatic disease.
And that's a disappointment, isn't it, Dr. Panda? When talk of vaccines started last year, it seems the goalpost has shifted. 1 year ago, we used to say, get the vaccine, get 2 of them, and you will not get COVID. And if you do, then it is a complete outlier. It is almost a statistical anomaly. Now we are saying, take the 2 doses to ensure that you survive potentially. I mean, that's frightening.
Yes. When we say COVID-19, actually, yes, you are very right. It's very important for us to work the science to people in such a manner that it's understood properly and scientifically. So when we say that once you get 2 doses of the vaccine, you won't get COVID-19, that means the disease or the symptomatic disease. But that needs to be clarified. You are absolutely right. So after getting 2 doses of the vaccine, the chance of getting to the severe form of the disease will be lessened, and one may not require getting hospitalized or requiring oxygen or getting to the ventilator. Yeah.
Okay. Dr. Panda, should there be a ban on all potential super spreader events like religious processions?
Yes, I have been very upfront and vocal about it. Anything that might lead to increasing the reproduction number for the organism you're talking about. And it is our responsibility. Health should be in our hand, and we should be cautious in terms of assessing a situation properly. So banning, not banning, that's the job of the program planners, policymakers, and decision makers. What I would say, for us to be able to appreciate what is the situation where the transmission of infection from somebody who is infected to somebody, some other person who is susceptible is much more. And naturally, mass gathering or any potential super spreading event should then therefore be avoided. Okay. So, because that could lead to increased RO.
Are booster doses inevitable?
Honestly speaking, Vishnu, we are in a phase where we must say we do not have enough data or information on that. So the point is about the duration or the durability of the immunity that one acquires following natural infection or post-vaccination. But once we get to know more about it, we'll be more certain about it. So it could be a possibility in future, and that's very near. So very soon, maybe within 5 or 6 months, because we are seeing now reinfections happening. We have pretty good idea about what could be the proportion of the reinfections. Reinfection is all about getting infected, having some kind of immunity built. But despite that, you are again getting reinfected maybe after 6 or 9 months or
sure.
so. So we'll get more information on that acquired and gathered through research that's going on.
How soon will children in India start being vaccinated? Zydus Cadila is going to get its EUA or not, but we'll know very soon. Assuming it does, then that's certainly targeting children. Then there is Bharat Biotech, but that I believe would be after January. So where do we stand with that?
Yeah. So children, and I'm sure that any vaccine, or for that matter, any medicine which is passed the clinical trial, that is tried first amongst young adults. So children are considered as vulnerable population. So now that the trial has already started, and we will get to know about the trial results, there will be interim analysis, of course. But even if it gets a bit delayed, but if we do our vaccination properly in terms of the most vulnerable group and the priority groups and the adults, children will be protected. And the National Sero Survey data, Vishnu, if you may allow me to talk about it, the third round, which got completed in January, there we realized that the seroprevalence amongst adults and children did not differ much.
No, it didn't. Yeah.
It didn't.
No, it didn't.
So
yeah, you're quite right.
There is no reason to believe that the fourth round would see anything different. And in fact, the fourth round is expected to see, a higher prevalence. Because if you remember, it was 0.7 during the first round, then 7% during the second round. And in the third round, it was around 25%.
Okay.
So if you go by that, you could, jolly well expect a higher seroprevalence
sure.
in the adult population, and almost the same, if my infectious disease, knowledge and hunch doesn't go wrong, very wrong, then I do not expect children to be differing much from the adults. So most of the children would be, in the same proportion of adults would be infected and developing antibody. So I won't hurry up the vaccine trial there. I would rather focus on, as you said, to remain cautious about the events that could turn out to be a super spreading event, and realizing that en mass movement from one area to another, which is actually a thinly or rarefied population residents. There, if the outsiders go, actually the density gets changed,
sure.
and it produces a conducive environment for transmission.
Dr. Panda, because I'm running out of time, as I see it, the big points emerging from our discussion here, there will be a third wave. It will not be as strong as the second wave, and that its onset will be at the end of August, right? The last week or two of August. Is that correct?
Provided we avoid super spreading events.
And if we don't?
And if we don't, then the third wave could, even for smaller states or areas where people are not living in a very population institution, their third wave could even reach the height of the second wave. Because there they had a smaller first wave, a
sure.
smaller second wave. So naturally the third wave will be bigger because the vulnerable population is much larger number there. So we should be very, very cautious.
I think these are sobering thoughts, and I think it's so important that we need to always remain careful. We are far, far from winning the fight against COVID. But thank you for so lucidly explaining it to us. Dr. Panda, it's been a pleasure speaking to you. We need to take a short break. There's more coming up right here on NDTV 24/7.